Hello guys, welcome to my YouTube channel. Today we will talk about malignant pleural mesothelioma treatment, its symptoms. What are the symptoms? Other symptoms include persistent cough and hoarseness, difficulty swelling, lower back pain, swollen face and arms, unexplained weight loss, night sweats, fatigue and fevers. What causes pleural mesothelioma? Asbestos exposure causes pleural mesothelioma in 70% of cases, and these are the only cases researchers known for of our sure. That number may be higher. Asbestos consists of fiber that become tiny airborne particles when disturbed. These particles settle in your lung if you inhale them. They are too tough for your body to break down. Over time, these particles can cause scarring, inflammation in your lung. They are also called changes that leads to cancer. Intact materials containing asbestos or safe asbestos are only processed a health risk when disturbing. The material releases asbestos particles into the air. Scientists are researching potential causes of mesothelioma unrelated to asbestos exposure. Other causes may include previous radiation therapy directed at your chest, genetic mutation that run in families, missing BAP1 gene, exposure to carbon nanotube, a building material that used to reinforce other structure currently found in vehicle, sports equipment, and many other material. Many research is needed to understand how pleural mesothelioma develops when asbestos isn't in the clear causes. Who is at risk for the pleural mesothelioma? Most people diagnosed with a pleural mesothelioma have spent years working jobs that expose them to large amount of asbestos. Men and people design male at birth, AMAB, after work in their positions. Mesothelioma takes several years, 50 to 50 years to develop. Many people receiving diagnosis at retired, about 65 and up, but worked around asbestos for years before it was regulated. Professions most at risk for asbestos exposure include construction and workers and the builder, including shipbuilding, Navy service membership who worked in the shipyard, automotive factory, and railway workers, installation manufacturers and installers, firefighters, plumbers, miners. You are also at risk of asbestos exposure if you live with someone who works around asbestos and bring the particle home on their clothes, live near an asbestos mine or demolition site with building containing asbestos. What are the complications of pleural mesothelioma? Up to 95% of people with pleural mesothelioma also experience pleural effusion. This condition occurs when fluid builds up between your lungs and the chest wall. Pleural effusion can make it harder to breathe. You may also have signs and symptoms associated with other conditions that often, but not always, occur alongside pleural mesothelioma, including pleural plaque, area of thickened tissue on your pleura. The plaques aren't cancerous and don't cause symptoms, but they usually appear on imaging. Asbestos, benign lung disease that you get by the inhaling asbestos. It causes scar tissue to form into your lung using breath harder. Your health care provider can recommend treatment to relieve symptoms like difficulty breathing or pressure on your chest. Diagnosis and tests. How is pleural mesothelioma diagnosed? A healthcare provider will perform a physical exam, review your medical history, and assess risk factors. This may recommend imaging tests, chest X-rays show lung changes like pleural thickening or pleural effusion, fluid buildup. Your provider may also order an MRI, CT scan, or positron emission tomography scan to see where the tumors are located if the cancer spread. Blood tests. Your provider may test your blood for high level of substance and often linked to the mesothelioma such as flublin and 3 and soluble mesothelioma related peptide. Thoracentesis. Your provider may remove a fluid sample from around your lung to check your cancer cell. This thoracentesis can also help relieve pressure in your chest from fluid buildup in your lungs. Biopsy. Your provider may remove a tissue sample to test it for a cancer cell. Biopsy is the only way to know if you have mesothelioma. The procedure, including bronchoscopy, thoracoscopy, and video-assisted thoracic VATS surgery. VATS surgery. What are the stage of pleural mesothelioma? The cancer staging allows you to provide to plan treatment and determine how advanced the disease is. The stage pleural mesothelioma from 1 to 4, which one side at least advanced and 4 being most advanced. Stage 1. Cancer is only in your pleura. At this stage, you may make condition for treatment like surgery to get rid of cancer. Stage 2. Cancer may have spread beyond your pleura but is still near the original site. Stage 3. Cancer may spread to nearby organs and lymph nodes. Stage 4. Cancer have spread to the organs. Metas, metastasis. Understanding your cancer stage can help you provide plan for the most effective treatment for your health and well-being.